Live at ASCO with Professor Bertrand Tombal from Saint-Luc in Brussels. What were for you the most interesting presentations in the field of uro-oncology?
So that's easy, and this year is really once again a very major year with the presentation of the result of the CHARTED trial by Chris Sweeney, who has looked at the role of docetaxel in hormone-naive metastatic prostate cancer patients. We know that most of these patients do poorly. We know, for instance, with the study we did with the Garlix, that 40% of the patients will progress within 1 year. And here, Chris Sweeney has investigated adding 6 cycles of docetaxel to these patients. And it shows an unbelievable overall survival benefit compared to the benefit we have with docetaxel later on. So really, that is one practice-changing study. The intent to treat analysis showed that the benefit is for everybody. He shows some subgroup analysis where, at this point in time, because patients still have to die, the benefit is absolutely marked for patients with high burden disease, more than 4 bone metastases. But when we look at the curve of the other, there is already a separation, so I would not be amazed if in 1 to 2 years from now, he show an increased overall survival benefit. So really, this is practice changing.
Would there be a place for cabazitaxel afterward?
But what is interesting is that in that subgroup of patients, it moved cabazitaxel as the first chemotherapy once they become resistant to castration. And there are several publications, and I just one went out on European Urology, really confirming that cabazitaxel is an extremely good chemotherapy. So really, the future is what we anticipated a few years from now, is that docetaxel will move earlier on in the treatment of patients, probably in those at high risk, and it's not unlikely that the first most active chemotherapy in the castration-resistant prostate cancer will become cabazitaxel. Other study, one that is extremely interesting but very preliminary, is that short study from the group of Hopkins when they look at the predictive value of having a specific splice variant of the androgen receptor on circulating cells. And in contrast to many other biomarkers that usually give a trend towards some level of response, this one simply show almost no response. So the data are preliminary, but in that subgroup, in that analysis, if they look at patients that were carrying the AR7V splice variant, meaning a truncated form of the androgen receptor, they were simply not responding at all to enzalutamide and abiraterone. So it is extremely promising. No, we're still lacking 2 things, a larger trial and the technology being widely available, because at this point right now you still need to extract CTC and do sophisticated PCR to unveil that splice variant.
Okay, thank you very much for this interview.
You're welcome.